Hi, I'm Dr. Keith Chambers from Chambers Clinic, and I want to welcome you to the annual Patient Appreciation event. This year we're going to be virtual, so more people can see it and we can have live feeds from the different doctors on staff, and that way you can rewind the information and get it all to keep in your mind. This year we've had a lot of great opportunities. We've expanded our Tempe location, bigger and better, and with a lot more services available, such as a cryotherapy, a larger IV room, an aesthetic suite, and a number of other options for that location. We also had added to our staff a number of doctors. Dr. Jake Pisanka, he's a specialist in integrative cancer care and was founder of the Longevity Medical Health Center, and he came on Chambers Clinic earlier this year, as well as Dr. Julie Kiefer. She's one of the premier aesthetics doctors in the Valley, and Dr. Arina Rybakina, who does mostly women's hormone treatments.
Hey, this is Blake with Chambers Supplements. Thank you for tuning into the live feed. Your promo code for the 20% off supplements online is going to be Chambers2020. Thank you.
Good evening, everybody. Awesome to see you again here at Patient Appreciation. A little different this year. Usually we're out in person, but we can't do that. But we're so glad that you've joined us online this year, and hopefully we can get together soon for a party when the time comes. It's my third year doing Patient Appreciation, and I'm really excited to talk to you this evening about self-care. COVID-19 has really disrupted self-care. Quarantine has disrupted self-care. And as we see patients come in, it's a wonder to us, is COVID-19 a virus, or is that the amount of pounds that everybody has gained in quarantine? We have this amazing opportunity, yet COVID-19 is making us a little bit anxious. But we've had several months to live with it now, and I think we can have kind of a go forward on self-care. I think in the beginning, it was really hard. A lot of us were reaching for that extra glass of wine, that extra bit of comfort food, that extra couch time. And we've been hearing that a lot, but this is a real opportunity to focus on self-care. We're here, it's November 9th. We are moving into fall. The weather has changed. This is traditionally cold, flu, pneumonia season, and this is when your immunity has to be at its top. So let's get back to basics on self-care and top up that immunity. We hear a lot of talk about vaccines, but let's talk about the vaccines that are within our own body, and that's staying healthy. So how do you do it? Well, let's listen to Einstein. E equals mc squared. I'm going to redefine that for you. EMC squared means eat, move, chill, and connect. So what do I mean by each of those, and how do they relate to self-care? A lot of us have not been eating very well throughout this pandemic. And then what happened is as things got a little bit lax and we can go back to our favorite restaurants, we kind of overdosed on because we missed them. The COVID-19 and being inside is an opportunity to reset on food. We theoretically have more time. We have less commuting to do. We have more time with family. Well, how are we using that time? Let's use it to cook or to learn to cook. Let's pick one meal a day at least and prepare it from home. When you prepare a meal from home, you have complete control over what that is. Need to get more veggies in your diet? Great. Find recipes and get more veggies in your diet. But you got to eat in a way that is going to nourish your body. We're really easy. It's a convenience culture. It's easy to grab comfort foods, but we want to eat in a way to nourish your body. So let's prepare meals at home. That's number one on eat. Second, you need to eat in a parasympathetic state. What does that long word mean? It means you need to relax. And we're going to get to the chill component in a minute, but we're around family now. Let's have a nice, pleasant meal around people that help make us laugh and who we enjoy being around. Those are things that when we're stressed out, it constricts the gut and it impairs our digestion and we get indigestion. And we don't want that. We definitely want to be eating in a parasympathetic state. The other thing is that we want to eat things that don't inflame us. How do we know that? Well, you can come here to Chambers Clinic. I can run something called a food sensitivity panel, and we can find out exactly what foods are inflaming you. And if that whole panel lights up, I know you have something called leaky gut, where foods are just trickling into the bloodstream and the body's attacking it. Well, in a situation like COVID-19, where we need our immune system at its best, we don't need it attacking other things, least of all the things that we eat. So we have some things that can heal up the gut. Something you can go get at the store or in our supplement store is aloe vera juice. That is very soothing to the gut. And L-glutamine is something that almost acts like a coating, and it can kind of heal up those leaks. And getting on a regimen of that, 5 grams, you mix it in water, it's tasteless, it can really help heal the gut up. Let's go back to that parasympathetic thing. Let's get to our second thing, and that's chill. We need to relax. COVID-19 is stressing us all out. We don't need to be stressed out. Stress is the biggest condition that we see here at Chambers Clinic. I don't care if we're dealing with cancer, with gut, with hormones, it is all caused by stress. So we need to relax. When we're in a relaxed state, the body is happy and it can work the way that it needs to work. We mentioned gut. When you're stressed out eating, it constricts. Hormones get confused. You'll hold on to fat. The signaling will be off. Women can get wonky periods when they have stress. If you think about it from an evolutionary standpoint, we wouldn't even want to have a baby in a stress environment, and so that's one of the reasons that a period can get a little bit wonky. Stress can cause guys ED. The easiest way to correct that is to not be stressed. So how do we do that? If you are religious and you have a prayer practice, that's a really great thing. Doing that a couple times a day resets. Having a gratitude practice in particular, thinking kind thoughts about other people, really helps to reset the body and stress it down. You can also take a walk. We're going to talk about move in a minute, but pounding those problems into the pavement is a great way to relax, and it doesn't take any special equipment or anything. You just strap on your shoes, and it's getting a little chilly, so maybe a sweatshirt, and you just get out the door, walk around the block. It doesn't take much. So let's get on to that move piece. Do you need to be a bodybuilder? We couldn't get any weights through Amazon during COVID-19. We couldn't go to the gym, and so a lot of people fell out of the habit of moving. But like I said, it's as simple as walking around the block. Studies now show it's not 10,000 steps like on the Apple Watch, it's 3,000 steps, as little as 3,000 steps. That's a walk around the block for most people, something around a half a mile to a mile. Now, if you're somebody who has a little trouble walking, start doing little experiments, little sorties. Go walk to the mailbox and back, walk to the stop sign and back, walk to the end of the block and back, walk 2 blocks and back, and so on and so forth, until you kind of build up the wind and build up the muscle mass again to support something like that. Movement, I also recommend sweating once a week. If you can get some go in and sweat, that sweat is actually the body detoxifying itself. It's getting rid of the toxins. The biggest excretory organ that we have is the skin. One of our other big excretory organs is the lungs. So if you're huffing and puffing, that means that there's more exchange and more waste leaving your body. So get out and sweat once a week, and also out for some gentle exercise in between those heavy sweat sessions. The other you can do helps to ward off osteoporosis and a lot of other things. Lift heavy things. Now, I was talking about weights earlier. It can just be as simple as just lifting a rock in the garden if you're confined to just your house. But you can also do body weight exercises. How hard is it to do 1 push-up? Try that. That's a 5-second activity. You're lifting your own body weight, and you can build from there. Turn it in the next day to 2 push-ups, 3, or see how many you can do in a row, and that's your number. If it's 10, if it's 5, if it's 1, you just do that until you can do 2 or 11, and so on and so forth. So you can do body weight exercises, push-ups, squats, and planks. These are things you can go look up online. These are very easy body weight exercises that are total body and can help tone everything up, particularly after we've been sitting around. All right, let's talk about the connect component. Well, the connect component, I'm talking about human interaction, and COVID has completely restricted that from us. We can't see each other in person, sometimes not even our families. We don't want to get grandma sick. We don't want the kids to infect others when they go over to other people's houses. So how do we continue to connect with others? We have our own little bubbles and our own family dynamics, and some bubbles have extended to friends, but how do we continue to connect with everybody? Zoom has been great for this. You can call friends and family, have little parties online, and continue to laugh and laugh our way through all of this. And that laughter is really the best medicine. That human connection really helps us. For the family that you have, studies are showing that that human touch is one of the most important things to help relieve stress. So give your kids a hug, give your husband or wife a hug, or your partner. Go ahead and get intimate. We have more time now. Theoretically, in these relationships, you should be having a little bit more sex because we have more time to think about it, and it puts us in a relaxed state. So that's a prescription from me, giving you a little permission to do a little more nookie. There, I said it. The other ways you can connect, you have to connect with yourself. We mentioned prayer earlier. Prayer or meditation, and just settling in with yourself is something that can calm you down and can get you through the day and keep the anxiety at bay and from getting the best of us. And finally, you got to put all these things together. These are all things I wish everybody did before they ever came to see us here at Chambers Clinic. So don't tell Dr. Chambers that I'm giving you hints and tricks to not see us. I don't know how he'd feel about that, but we want you well. I know he feels good about that. Put it all together. You got to sit down and put it all into a more routine, put it all into some kind of routine. Sit down and plan your menu for the eat portion. Breakfast, lunch, dinner, all week. When are you going to have leftovers? Go ahead and plot it down. Make yourself a grocery list. You head to the store and you go get it. That chill component. When are you going to do your 10 minutes of prayer or 10 minutes of meditation? Morning and night. Do you need an app for that? Download the app. Plan it out. Your move. When are you going to do that? My patients do best when they wake up and get out the door. There's no excuses, and by the time you get halfway to your destination, you got to turn around and come back. So you've now doubled your exercise, even though you've cut it in half and doubled that. But when there's no turning back, it makes it a lot easier to do. You got out, you did it, you checked it off the list for the day, and there you have it. You've moved. You've also done the chill component. You've relaxed there. And you got the meditation out of the way, you've gotten the movement out of the way, and you can face the day in a very relaxed state. And then going back to the eat component really quick, just making sure you get some servings of vegetables in your diet. These are anti-inflammatory. Look online. How do you julienne a carrot? These can be fun little activities in order to learn new things about how to cook and how to prepare food. There's plenty of meal planning sites on there. You can wormhole hard on Pinterest and learn how to prepare meals for the week. You can really learn a lot, and particularly since we're stuck a little bit more indoors. Even though things have loosened up, we're stuck a little bit more indoors. So putting it all together, eat, chill, connect, move, put it all together in one place, and you will help your immunity in a very subtle but very profound way. And that should get us through what's going to be a very interesting cold, flu, pneumonia, and now COVID season. If you have any questions, please reach out to us. Our medical assistants are fantastic. They get a hold of us. We're really excited to share knowledge with you and help you through any challenges. So hope this has been helpful. I'm excited for you to hear the next speaker, and thanks for listening.
Thank you, Dr. Wall. It's very important for all of us to take care of ourselves and our mental health, as well as we're here to help all of the patients to ask any questions at any time. Next, we're going to have one of our most trusted vendors, Jigsaw Health, send a message. And after that, Dr. Royer is up with her information on women's health and women's hormones.
At Jigsaw Health, creating the highest quality nutritional supplements is of the utmost importance. We believe in our products and we take them ourselves every single day. So do the members of our families. Hi, I'm Carissa, and I'm in charge of making sure what's on the label is what's in the bottle and nothing else. Our facility is registered with the FDA, and we use industry standard good manufacturing practices, or GMPs, to make all of our products. GMPs are guidelines that provide a system of documentation and procedures to ensure our products have the appropriate purity and potency. There are many steps that go into making our products. The most important step is testing. We literally triple check our work from beginning to end. First, when raw materials are received, we test those for purity and potency. Second, when the product has been blended together and assembled into its final state, we test again for purity and potency. Finally, when the product is received at our fulfillment center in Scottsdale, Arizona, it sits in quarantine until an independent third-party lab can verify the results of the first 2 tests. And we publish the results of each batch of Jigsaw Health products on our website for all to see. Does this amount of testing add extra cost? Yes. Does it take a little longer? Absolutely. Do all supplement companies do this? Unfortunately, no. But I hope we're leading by example, and I hope more companies in this industry follow suit. Because nothing is more important to us than the safety of our families and yours. Our tagline at Jigsaw Health is "It's fun to feel good." And whether you choose to use Jigsaw products or a different brand, we just want you and your family to feel happy and healthy. Because life is way too short to feel crappy. Thank you for placing your trust in Jigsaw Health. If you have any questions, please reach out to our customer happiness team.
Chambers Clinic was the primary research facility for the Scottsdale Magnesium Study. We recruited patients who were not previously taking any magnesium supplements to participate in the clinical trial, which compared MAG-SRT to a placebo. Day 1 was quite a challenge for patients and my staff. We had to draw blood first to establish a baseline for serum magnesium and RBC magnesium. After the patients took MAG-SRT or the placebo, we drew again at hour 4 and then again at hour 8. It was a long day, but the measurements helped us to observe the sustained release technology and watched how MAG-SRT passed through the intestinal wall and into the bloodstream. There was a 22% increase in serum magnesium. We had a 30, 60, and a 90-day follow-up with patients to measure RBC magnesium. RBC magnesium allows us to see how magnesium was assimilated. And there was a 30% increase in RBC magnesium after 90 days. I'm very excited at the results and congratulate Jigsaw Health for investing in this human clinical trial.
Hi everyone, I'm Dr. Lacey Royer. I'm a naturopathic doctor here at Chambers Clinic and I specialize in hormones and gut health. I work with women and men replacing hormones to help with optimal health and wellness. I also work from the inside out, establishing a healthy gut so that the hormones can work more effectively. Today I'm going to talk about menopause and the hormone production and how that affects our heart, brain, and bone health. So in menopause, we tend to have a lot of yucky symptoms that are no fun. They're not pleasurable whatsoever. Women come to me and they complain of hot flashes, fatigue, low libido, night sweats, bone pain, poor memory, poor mood, all that non-fun stuff. So as the levels of hormones decline, we tend to see a lot of different diseases approach. So we know that when we age, a lot of cognition goes down. So we have an increase in Alzheimer's disease, we see an increase in diabetes, we see an increase in high blood pressure and cardiovascular disease. Now, is that a coincidence or is that because our hormones are dropping? I say the hormones. So anyways, when we see a decrease in estrogen, we see how it affects our bone density. We see increased risk of osteoporosis. Testosterone level goes down. Not only is it affecting our low libido, but it's also affecting our cognition and our mental well-being and our mental clarity, also our bone health and cardiovascular health. Some other things that we tend to see in menopause is decrease in vision, disturbed sleep, increase in diabetes and cardiovascular disease. Our skin even starts to sag and we feel old and we look a little bit more wrinkly. We have less plumpness and firmness to our skin and our muscle tone. The reason for this is because of the estrogen, progesterone, and testosterone declining in menopause. You might think of menopause as only like hot flashes and night sweats, but because of the receptors all over the body for all of these different hormones for estrogen, progesterone, and testosterone, it has a lot more effects, especially when it comes to the brain, bone, and heart health. The first hormone that I'm going to talk about specifically is estrogen. It has a lot of effects on the body and it's really, really fantastic. So first of all, it helps to decrease LDL, which is the unhealthy form of cholesterol. It's the big and puffy one that can get stuck in the blood vessels and lead to atherosclerosis. It also helps to increase HDL, which is the healthy form of cholesterol. It prevents oxidative stress from occurring from free radicals, so it acts as an antioxidant, which is super cool. When we have low antioxidant status in our body, we tend to have more inflammation, which causes a lot of brain defects, so difficulty in thinking and cognition, and that's where Alzheimer's sets in. It also inhibits platelet stickiness. So platelets are what are involved in the clotting system in the body, so it helps with stopping bleeding. When we have too many platelets or too much stickiness, we can lead to cardiovascular disease and atherosclerosis. So estrogen also helps to increase blood flow, which is super important. That's how it also helps to lower blood pressure. It works on the vessels to increase the blood flow to the brain, which also helps with cognition and memory. So as we age and our estrogen declines, then we have less blood flow to the brain, which is a huge issue, which leads to a lot more oxidative damage like I discussed before. We also see that estrogen decreases an inflammatory marker in the blood called homocysteine. So homocysteine, when it's elevated, will cause inflammation in the vessels, and that will lead to cardiovascular disease. So when we have low levels of estrogen, our homocysteine is elevated, which increases our overall inflammation and our increased risk of cardiovascular disease. It also improves insulin sensitivity, so it's going to increase your glucose levels in the blood, which will also help to prevent diabetes, which is extremely important for heart health and overall brain health, because when we have too much blood in the vessels, it tends to cause some more occlusion. We don't have as much blood flow to the brain and to all of our organs, so then we have second-end organ damage, like kidney disease and poor repair of our skin, so we have a lot more decrease in wound healing. Estrogen also increases bone density and muscle mass, which is also helping to decrease our risk for osteoporosis. And it also helps to increase blood flow to things like the eyes. So as we age, our eyes start to go, right? We start to lose a little bit of our vision. Things like macular degeneration become something of a problem. And estrogen helps to increase blood flow, so it helps to get more oxidants and nutrients to the eyes, so that way macular degeneration doesn't occur. So I hope you can see that estrogen is super important for overall health, especially when it comes to who are transitioning through the menopausal age. Next, I'm going to talk about progesterone. Progesterone is fantastic. I could talk about progesterone for probably 3 hours, but we're just going to talk about it for about a minute or so. Progesterone helps to balance out estrogen levels. Now, when we don't have enough progesterone in the system, we become estrogen. Now, that's a whole other topic we're going to talk about another day. But progesterone is super important for helping to balance all the different effects of all the other hormones in our body. Progesterone also helps to lower blood pressure along with estrogen. So as we age, all of our sex hormones go down, like I said, so estrogen, progesterone, and testosterone. So because of all of this, we see an increase in blood pressure, we see increase in cholesterol levels, we see a lot of difficulty with sleeping, all of those types of things. And progesterone helps with all of those as well. So progesterone helps to lower blood pressure. It also helps to lower cholesterol levels, and it also promotes fat utilization in the body, which is super cool. It also helps to promote myelination in the brain. So the myelin is the protective sheath of our neurological system. And so when that goes down, our brain functioning goes down. So it also helps with brain health as well. Another really cool thing that I tend to use progesterone in my patients a lot of times is before bed. So progesterone breaks down and hits GABA receptors in the brain, which is very calming. It's an anxiolytic neurotransmitter. And so because of that, you tend to have a lot more relaxation. You can sleep a lot better because insomnia is a big thing with patients who are in the menopausal stage of life. Next, I'm going to talk about DHEA and testosterone, just a teeny tiny bit. So testosterone is another one of my faves, and I replace this in women a lot, not just in men. And it tends to really help with their libido, their energy, their mental cognition, how they feel about their life overall, just the way that they see the world, their mental outlook and clarity. It's absolutely amazing. DHEA is the precursor to testosterone and other androgens. It's the right before testosterone is made, DHEA is the immediate precursor. DHEA, when it's low, can lead to a lot of pain, And we see a lot of anxiety with that as well. So when DHEA and testosterone, we tend to see a decrease in our mental sharpness. We see a decrease in bone density, and we also see muscle mass decline. What's really cool is that testosterone replacement has been shown to increase bone density by 8% each year, which is big. It's huge. Also, testosterone is really helpful for like the thickening of your skin. So as we lose testosterone, we tend to age a lot. So we see a lot more of the thin skin. We look a lot older. And then when it comes to cardiovascular disease, if we have less testosterone, then we also see a lot more triglycerides in the body. So I have patients who get on testosterone and they have high triglycerides, high cholesterol, high glucose. We get them on testosterone and get their testosterone levels optimized. And then we see that their triglycerides and cholesterol come down way to the point where they're in the healthy range, which is absolutely fantastic. All right, so that concludes my talk today about hormones and how they affect the brain and the bone and heart health. If you have any questions or if you feel that you are one of the target patients who might be ideal for hormone replacement, please give us a call, schedule an appointment. We have a lot of great docs here. Thanks for being our patient and thanks for listening. Have a great day.
Thank you, Dr. Rua, for your insights on women's health and hormones. Next up is Dr. Julie Kiefer. She's an expert in aesthetics and skincare.
Good evening. Welcome to my first patient appreciation at Chambers Clinic. I'm Dr. Julie Kiefer. I'm one of the newer faces you'll see at Chambers Clinic. I've had the pleasure of meeting some of you, but this is a great way to introduce myself and let you know what I do at Chambers. I specialize in anti-aging and all things aesthetic, sexual enhancement, and today I want to talk to you about what I look for when I'm assessing someone's face. And we do offer a 15-minute no-charge consult, so if you want to come in and have me do this on your face, no judgments about what I see or what I point out. It's just an educated eye to help you to get to where you want to be, which is looking as good as you feel. When I assess a person's face, I'm looking at multiple levels. I start with the surface, and I'll look for reds or browns, or really anything that is going to absorb light. If you look at a child's face, light hits their skin and reflects off. We're really looking for this, because that's what gives the essence of youth, or the just the appearance of great health, and that you're fresh and approachable. And that's part of it also, because other people are assessing you, they don't know they're doing this, but even before they talk to you, they're assessing whether you're in a good mood, whether you're usually in a good mood, what kind of health state you're in. And it should reflect what you want to say, or what am I trying to say? To exude to the rest of the world. So when I look at the surface, I'm looking for anything that's going to absorb light. The first thing would be reds and browns. Reds would be little telangiectasias or broken blood vessels. Those can happen from trauma or from prolonged sun exposure. Browns come in a variety of sizes, whether they're raised or not raised. They can be from sun exposure. They can be seborrheic keratosis, which most of us know as like age spots, and they're just tan and a little bit raised. What other browns? Moles, but moles, unless you hate them, really those are not seen as a sign of aging. When I look at the surface for other things that might absorb light would be wrinkles that are in the skin. If there's a wrinkle in the skin when you move, that's different than if the wrinkle stays there when you're not moving. When you're not moving and the line's there, it's now kind of like a scar. It's as though you folded this fabric so many times that when you lay it flat, it still has that crease in it. That can be reversed, believe it or not. I've seen it done. So the area that has the most impact on people when there are lines on the skin or in the face would be here. Because when you make that face that scrunches and makes those deep lines, it's usually not a happy face. It's usually an angry face or a frustrated face. So if those lines are there, even when you're not feeling those emotions, people interpret that, whether they know it or not. And this is also exactly where people look, between the eyes. So if you can open this up and look inviting and not like you're angry, or at least not angry most of the time, it changes the world you operate in. So that would be the surface. Pores, enlarged pores are another thing that would absorb light. And there are some things we can do to help minimize pores and shrink them. As we age, they tend to enlarge. So whether it's topicals at home, treatments in the office, there are things that can address each one of these things that I've brought up. For women, hair on the face, dark hair will also absorb light, or at least prevent that reflection of a really nice, bright skin. So hair removal is one of the easiest things to do, especially if it's dark. Laser hair removal is, available. And I have multiple lasers that can treat all different skin types, including the darkest of skin types, for hair removal on the face. Let's go a little bit deeper. When we go a little deeper into the face and take a look at what indicates aging, there are things changing, like the fat that exists underneath the skin. And most of us are concerned about having excess fat on the body. The reality is, fat in the face gives this nice plump, juicy kind of bounce to the skin, and we want that. Those fat pads in the face, they do naturally start to go away or diminish, and they also are affected by gravity. So we'll see there's a malar fat pad, sits right here, and over time slowly starts to come down and shrink. That's what would give us this nasolabial fold, those folds that would happen here. So by restoring that back up, or adding a little volume and bringing that up, it takes away that shadow that happens in the nasolabial fold. This happens in the cheeks, in the temples, they hollow out. And so these are little changes that happen over time that by small tweaks, we can restore what you looked like. Nobody wants to look frozen. Nobody wants to look like they came out of a wax museum. And so it will always go at your pace. Slow. You get to watch often while I'm doing procedures, and we can decide that's enough or a little more. But restoring volume to the face is really important if it's been lost, and most of the time it has. Gravity plays a role. So everything has this kind of downward force, and if we can restore that back up, one of the easiest things to do is to walk around operating in your life with a partial smile. It holds the cheeks up to these apples. So if you just look at someone with a partial smile versus, that's free. All you have to do, your world will change, because when you walk in, you look inviting and have this elevated cheeks and this awareness and openness to be interacted with. Bone loss, that has to do with hormones. Hormones, we cannot forget hormones in skin and face and aging in general. So there are some topical things that can be done for females with estriol, and that helps to maintain the dermis. As we age, okay, so as a child, the dermis is really thick, which is below the surface, and then the epidermis, which is on the surface, is thin. This is a child. As we age, that reverses. So we get a thickened epidermis and a thin dermis, which is the spongy part of the skin. What we want to do is reverse that more to the youthful of a thickened dermis and a thin epidermis. When we do that, we have that youthful, bright look to us. So much of what we would be doing is restoring that dermis, and oftentimes it's like a controlled stimulus or a micro trauma that stimulates the body, because the body is so inherently intelligent. It knows how to create the healing. So if we give it just a little stimulus, it will respond and create its own collagen. And that's really ideal, because that's where we look like ourselves and not like we've been pieced together like a doll. So just a little bit about what I do here at Chambers, and I invite you all to come in and have a 15-minute quick consult. We can discuss what options are available, what I see, what you see. If it's stealing your energy in a day every time you see something, it has to go, especially if we can do something about it. It's sometimes really, really simple to be able to make these micro changes that will enhance your life and give you a happier day, basically. What I'd like to do is show you a couple of faces and how I would go through and look at things. We won't take very long with this, but I have two lined up, relatively young, but you can start at any age because really prevention's the better way to go. If you never create those lines or you take care of your skin along the way, you never end up having to do these huge treatments or something that requires a wand to get done. So let me go ahead and get my models. So we are going to take a look at the fabulous Jen, who you know from the clinic, and if you don't, you should come on in and meet Jen, but she's nice enough to be a model for me today. I'm going to take a look and see, she's young, but there are things that we can do that might make her feel fresher and operate in the world in like more confidence in a happier way. You also have the start. Go ahead and scrunch your brows for me. Not bad. But if we can prevent this from becoming lines in time, great, you can relax. But you see these cute lines? These lines, they do absorb a little bit of light when she's smiling, but those people tend to interpret as they smile a lot. And so those are much less offensive when we're talking about lines in the surface than these would be if they were deep. Now for Jen, she's got gorgeous volume to her face. And her cheeks are nice and high still, and nasolabial folds really kind of don't exist. That little bit that shows up when she smiles, that's natural. We don't need to puff those up at all. Gorgeous lips. I mean, Jen's in pretty good shape. The one thing that might be fun to do with her would be to create more of an arch to her brows, which would be pretty easy to do with a very small amount of a botulinum toxin. The other thing, I mean, lips are always fun, but she's got great lips, and the corners of her mouth are not turned down. So there's not a ton we could do with Jen, or that I would recommend. Probably all surface. Anything that's going to create more of a even tone on her surface of her skin, and that could be at-home product and combined with in-office treatments. But she's clearly been taking care of things. So the little tiny reds. So depending on whether those reds are short-term breakouts or they are remnants from possibly past breakups or any sort of trauma to the skin, if they're remnants that are there all the time, we can go ahead and close those with the laser and get rid of the reds. And so that would just clean things up a little bit. I cannot function without Mel, so we're grateful for her on multiple levels. She's with me all the time when I'm doing treatments. And just another younger person, so I just wanted to give you an idea of the different things that we could do. Gorgeous face, beautiful kind of sweetheart face that comes down to the nice point. The only thing on Mel, she's got a beautiful arch to her brows. Cheeks are good. Would be the pigment. So that's the only thing that's kind of absorbing light. Scrunch here for me. Not bad. She's not in a place. If she wanted to, she could do a tiniest amount of Botox just to prevent that from happening. But most people don't want to be frozen. There's just a little bit of pigment happening through her cheeks and on forehead. And if we could just clean that up, it's going to give an even tone, which is what people are trying to do with makeup all the time, is create that even tone. And wouldn't it be nice if all she had to wear was sunscreen and have that glow? And things wouldn't be absorbing light. So very simple again to be able to treat Mel and then work with her throughout the year so that she never really develops the need to do any huge procedures.
Thank you, Dr. Kiefer. We're excited about your vast experience in the area of aesthetics. Next up is one of our vendors, Priority One, followed by a discussion from Rudy Dragoni on how to balance your hormones for a healthy life.
Hi, I'm George Bynum with Priority One Supplements. We're a second-generation family-owned and operated company up in the Pacific Northwest, been in business since 1988, and we're very happy to be able to serve the naturopathic community around the country, around the world, and in Phoenix and Tempe, Arizona specifically. I've been fortunate to work with the company since 1992, so very, very grateful to have a wonderful history with a great company. We're known for having products that are nice high milligram strength, very affordable, easy for loading doses. We're also certified with the state of Washington and the FDA because we do all of our own manufacturing and distributing out of northern Washington state. Some of the products that I want to feature briefly today are some of our stress formulas. This is a product called Mega Stress. We have it in 2 different sizes. It's been very, very effective as far as being a good B complex. Also with some adrenal support and some adaptogens, your licorice and ginseng, very, very popular. And we also have vegetarian alternatives for people that don't want anything in the glandulars. We have this in 2 different sizes, both a 60 and a 120. Been very, very popular, and these are stressful times, so it's very important to make sure that your patients are taking good care of their adrenal health and not working themselves too hard or just getting burned out. Another very popular product is one called Anxiety Balance, which I have in 2 different sizes. We have in a 45 and a 90. It's very, very nice for people that are worried about a lot of things. I've had students taking it on days when they're having a midterm, a final, or a board exam. Really, really helpful as far as allowing the mind to relax and think clearly and remember what they've studied for, but sometimes are blocking because they're concerned about having a bad grade, and that can be a self-fulfilling prophecy. Some other products, some of our very most popular immune system supports. This is a product called BioVegetarian. We have it in 3 different sizes, a 60, a 120, a 180. Very, very good for the cold and flu season. Also good in the spring for allergies. I've had doctors and patients taking it internationally when they're traveling in a 3rd world country, and oftentimes, no matter how careful they are, you can ingest something in the food or water that can have microbes that can really affect the quality of your travel plans. Very, very effective product. I take it myself as needed, and just very, very high commentary and favorable patient response. So that's a brief synopsis of 3 different products. Thank you very, very much. I really appreciate being able to have a video chat and share some information about these. George from Priority One, signing off.
Good evening. My name is Rudy Dragoni, and I'm here to talk to you about hormones. Many years ago, in the 1990s, I got involved with hormones back in New York, and came out here in 1998 and was working with a few doctors, and a few doctors became a few more, and before you know it, there were hundreds of doctors that we worked with. We've taken care of probably 100,000 or more patients, and the patients have taught us more than what we've been able to learn from books. Because of what the patients have taught us, I've actually written 3 books. I have 2 of them with me here. One of them is called Understanding Progesterone, and the other one is called Healing with Hormones. I have gone into doctors' offices where I've given this book, and they have ripped it apart and put it on the wall and actually used it as a teaching guide for patients. What we do and what we want to do is we want to not only give you the hormones that are missing from any lab work, and we can use either saliva or blood or even urine, but not put you into the ranges, but to optimize the ranges. I'm going to give you a $100,000 secret. The $100,000 secret is if you look at the ranges, and the ranges say that the normal is between, for example, 1 and 10. Those ranges correspond to an age group. Guess who has the 1? The 59-year-old, the 69-year-old. Guess who has the 10? The 19-year-old. I don't know about you, but I want to be more like the 19-year-old. So I always say 30-something forever. 30-something forever is to put you on the top 1/3 of normal. So even within the ranges that are considered normal, you can do adjusting up or down. I always tell people that the enemy of feeling great is feeling good. Because if you feel good, you don't stress to feel great. And I think that if you work with the hormones and understand what the hormones do, you can easily feel better and better and better. Because of this, I've got 18 different symptoms, and we have a sheet that we will be showing you. And the 18 different symptoms all correspond to a hormonal level. Now, you may look at them and say they're all different symptoms and they don't really mean anything to you, but they mean a lot to me. Some of the questions are like, if I asked you a question, where were you on Wednesday? Where were you the day after Tuesday? Where were you the day before Thursday? Those are basically three of the same questions. So three of those symptoms correspond to a particular hormone. So if we look at it and we say, this one is a 10 and it's really bothering you, I can almost be assured that two other symptoms are going to have 10s also, because they're all associated to a deficiency or an overage of that particular hormone. So now I look at those symptoms and see where those numbers are. And let's say it was a 10. Let's talk about insomnia. Insomnia is low progesterone, low vitamin D. Once we get the vitamin D above 60, which is what I always recommend, and get the progesterone up to the right level, then we look at it and say, there used to be a 10, but now it's more like a 5. And then a month later, it's a 3. And a month after that, it's a 2. And then you'll turn to me and say, leave it alone. Don't touch it, because we've got it exactly where you want it. Now, during that time, if we started you on 100 milligrams, we may go to 125, 150, 200 milligrams to get to you sleeping 7.5 hours. The goal is for everyone to be able to sleep a good 7.5 hours and wake up with your batteries recharged and full of energy. Depending on the symptom, and that's where this book comes in, depending on the symptoms, I have those 18 different symptoms adjusted and reassigned in this book, so that someone reading the book, that'll give you a good backbone to be able to talk to the doctor and a good reference point for you to be able to converse with the doctor and say, hey, yes, I have this symptom, I've been taking this, but something's wrong. I'm not absorbing it, or I'm not utilizing it in a way so that I could be able to change it, so that if the orals aren't working for you, then we go to a topical. And if the topical is not working for you, then maybe it's a buccal or something, but change the modality by which it enters into the body so that you can be sure that you're getting the right dosage. Pharmacy is there to help you at any time. I am available to everyone, and my phone number is 480-236-8248. I actually talk to patients all the time, 24/7, 7 days a week. So I'm available. I get calls from all over the country and even outside of the country. I speak Spanish, so I speak Italian, and a little bit of French and a little bit of Portuguese. But if you call me, I'll be more than happy to answer any of your questions. If you have your labs or recent labs near you or with you, then that would help, because then I'd get all the information that I would need. I'm not an expert. I've been doing this for 30 years, but I don't consider myself an expert. I think that anyone that says that they're an expert doesn't know hormones, because we're constantly evolving, constantly learning more from people. And we've got a lot of information, and we work in conjunction with the doctors. So the doctor will call me and he'll say, this morning I got a call from a doctor, and he said to me, Rudy, I have this patient, this is the age, this is this and this is what their labs say. How can we adjust it for them to be able to feel less of this? And together, okay, two heads are better than one. Together, we work together to be able to get to a solution. And then we have the third head. The third head is you. Because if you will understand your body better than any doctor will. And you will know your body better than any doctor will. So with your feedback, if I said to you, I have this symptom, and I adjusted the hormone down, and you said, well, it went from a 10 or from a 5 to a 6 or a 7. Oh, well, then we're going the wrong way. So then let's adjust it up. And if we adjust, well, okay, now it's no longer a 6, it's back to a 5. No, it's a 4, and then we adjust it a little bit more. It's a 3, it's a 2, it's a 0. Leave it alone. At 0, I'm feeling good. And I have a lot of patients. It takes about 3 months of adjusting. You feel somewhat of a relief right away, but then little by little with the adjustments, with your help, okay? You're the most important cog in this thing. With your help, we can fine tune it to the point that you'll feel great. And thank you very much for your time. And I hope to hear from you. And again, my phone number is 480-236-8248. Thank you.
Thank you, Rudy. You've been a huge resource for the clinic and our patients. Next up comes Dr. Jake Basenka talking about the benefits of shockwave therapy.
Good evening. Hi, I'm Dr. Jake Pasenka, and thanks for joining us tonight. I'm relatively new at the Chambers Clinic. I started here in February of this year, but I'm not new to naturopathic medicine. I've been practicing for almost 20 years now. I see a lot of different things in the office, although I have most of my experience as a physician who treats integrative oncology patients. So I help a lot of people, whether they've just been diagnosed with cancer or whether they're going through treatments or whether they are looking to prevent a recurrence. I also maintain a general practice as well. I wrote a book on allergies a few years ago, and I do a lot of men's health as well. I occasionally see kids, but not too often. But tonight, I'm going to talk to you about a cool treatment that we do called extracorporeal shockwave therapy. Say that 3 times fast. It's much easier to say ESWT is how it's known in the medical world. This treatment is fantastic because it's easy to do, it has no side effects, and it doesn't include taking anything like a drug. It was birthed out of starting with orthopedic medicine, so it was used for people when they had like tennis elbow or plantar fasciitis or a frozen joint like a frozen shoulder or extra calcification of a tendon. This therapy was used because it could accelerate healing in those joints or decrease the tightness in those tendons caused by the accumulation of extra calcium. The treatment is really neat. It uses an audible shock wave, so a shock wave travels through the tissue and it causes a micro trauma in the tissue that it hits. And when it does that, the body will recognize that micro trauma even though the patient doesn't really recognize the trauma at all. You might get a little redness to your skin, but it's not painful and doesn't cause any lasting problems. But the body sees and recognizes this micro trauma. And when it sees this, our bodies will try to fix it because our bodies always have this innate desire to correct any problems or traumas that occur in the body. So by using this shockwave on a particular area, you can increase the body's desire to heal that area. And that allows it to be used for a lot of different and interesting things. You know, a really good example that I can share is not too long ago I met a woman who had a frozen shoulder. She could not move her shoulder from this position at all. It had been about a week. Any movement would cause a ton of pain in this area. She came in and saw me and we applied the ESWT to her shoulder, and literally 20 minutes later she had a full range of motion back in her shoulder, and the frozen shoulder never came back, and now we're at least a year away from that. So it was fantastic for her to get that done to take care of that frozen shoulder. I've used it for tennis elbow as well and plantar fasciitis with pretty good results with those things as well. Another really cool treatment that it's used for is the elimination of cellulite. You know, cellulite is a condition where the connective tissue underneath the skin becomes weakened and it creates this dimpling type appearance. Well, when you put the ESWT machine on the, somebody just can't wait to talk to me. When you put the ESWT machine on the skin and cause that micro trauma, the body will respond by tightening up that connective tissue that underlays the skin and eliminate that dimpling appearance that's there. You can combine this with specific exercises and even some topical kind of fat burning or tissue strengthening creams that can really make it work well. Another treatment that we do a lot in the office that is quite popular is using the ESWT for erectile dysfunction. You know, this is a very prevalent thing. About 40% of guys over 40 years old have some degree of erectile dysfunction, and nobody likes that. And nobody really likes to take a bunch of pills either, or have to do some kind of preparatory work before you go out on a big date. So when you use the ESWT, basically you're using these shock waves in that area, and it hits the blood vessels, and those blood vessels are then exposed to this little micro trauma, and then the body responds by coming in and repairing and remodeling those blood vessels that are necessary for an erection to occur. No blood flow, no erection. So this treatment is fantastic because it's even effective in guys who don't respond well to drugs like Cialis or Viagra. And about 70% of those guys will achieve an erection that allows them to have intercourse again after going through this type of treatment. So it's really fantastic, and there's no pills involved. There's no real side effects at all. It's a simple, easy, and effective treatment, and the results can last for up to a year. So a lot of guys are really interested, and a lot of women are really interested in that treatment as well. If you'd like more information, give us a call on that. Anyone in the office can talk to you about any of these treatments. I've been using ESWT in my practice for a few years now, and I've really seen nothing but successes with it. And so I'm glad you tuned in tonight. I'm glad I got to tell you a little bit about this. If you have any questions, like I said, give us a call. If you're curious about what I can do in terms of helping with an integrative cancer approach to that disease, I'm more than happy to talk to you about it. I'm excited to be here and excited that you're here, so thank you and have a great night. Hi, it's me again. One more thing I forgot. If you'd like to get some more information about ESWT or read some of the studies behind how successful it is for guys with erectile dysfunction, I'm going to post a link in the chat box below that you can check out. You can also go to our website. We've got a ton of information on there. And also, I write blogs all the time on a bunch of different subjects, so make sure you check out the blog at chambersclinic.com. Thanks. See ya.
Hi, this is Dr. Virendra Sodhi, founder, CEO of Ayush Herbs. Ayush Herbs was founded on the principles of quality and the best products you can ever get. When we start manufacturing Ayurvedic extract, we used state-of-the-art technology to extract our extracts. And we start growing our herbs from ground up, and they were then extracted in our own facilities. We do the due diligence before and after. And I'm really thankful for our colleagues and friends who has made this company what we are today. I'm very pleased to announce that we are one of the most favorite Ayurvedic company among our peers. People use our products with a lot of great confidence, and I really want to thank all of you from the bottom of my heart. Here at Ayush Herbs, we are always looking forward for your feedback and want to get the best, and we are growing because you are helping us to grow. Thank you very much.
Hi there, I'm Jacqueline Clow. I'm the registered holistic nutritional counselor here at Chambers. Holistic nutrition would be whole body, so I look at the whole body, the diet, the nutrition, and the lifestyle. I analyze what nutritional deficiencies you may have, help get you on the proper supplementation to optimum health. I have a diploma in natural nutrition, and I have been a clinical nutritional counselor for 10 years, so a fair amount of experience. I'm also a herbalist. I'm a holistic herbal studies graduate. I've been practicing for 25 years. So what does that mean? I'm an expert in herbal medicine. I know what herbs and supplements that can support you in a positive way and get the best results for your health and longevity. My third most unique skill that I practice here at Chambers is that I'm a clinical computerized electrodermal screening practitioner. That's quite a mouthful. What's that? That's actually Vega testing. So I do Vega testing, which is a diagnostic tool with the Vega machine hooked up with the computer that helps analyze body and organ systems and helps get the right biochemical match for your particular constitution to improve any kind of disharmony or imbalance in your system. They've been using Vega testing in Europe for 75 years now. It's diagnostic work for finding the imbalances in your body, and it actually is very beneficial and insightful for finding what's the underlying reason for your symptoms you've been having or any kind of illness or family genetics you're concerned about, and you want to actually look into it before anything actually happens adversely. I also do epigenetics, which is the science of looking at your diet and your lifestyle, along with what biochemical matched foods, supplements, and vitamins and herbs will actually help improve any genetic problems that you or your family may have, so you can improve them before the genes have actually been flipped on with improper diet, improper lifestyle, or maybe just missing some nutrition. So the computerized Vega testing machine I do is a combination of an MRI technology and Chinese acupuncture. I go to the actual Chinese acupuncture points associated with the body or meridian. These have been scientifically proven to be associated with the body or organ system, and they've been using acupuncture and acupuncture points for about 2,000 years, and that's why a lot of the medical clinics and alternative medical clinics will actually realize that the acupuncture is a science, and they use it from anywhere from oncology to actually help balancing out any imbalances in the body. So that's why I choose to go with the particular Vol acupuncture points, which have been used for about 75 to 80 years in Europe. And the acupuncture points themselves correspond with the organ and body systems. For the last 2,000 years, they've been using them. So if I'm going to test something like the small intestine point here, that tip is actually an acupuncture point that's associated with the meridian or body system, and the meridian would go right down to that organ or body system. And I would get a read from 1 to 100, and we want to balance it out to a perfect 50, like the patient that's just came in. What can it do for you, the Vega testing? Well, I can actually assess food sensitivities and allergies, environmental and chemical sensitivities, see if there's any health related problems due to heavy metals, see what supplements would optimally work for you. That would be your biochemical match. If you have quite a few supplements at home, it's been a while since you changed up what you're taking, and seasonally we need different supplements. Now that cold season's coming, you might want to get on a good quality vitamin A, quality vitamin D, vitamin C. So you can bring what you do have presently in for supplements. We pop them on the supplement testing plate, and we'll see for that organ or body system whether it would actually be your best biochemical match, or we could go to the Chambers dispensary and pick a product out and test you until we can find the one that would be uniquely your biochemical match to bring up a body or organ system or boost up your immune system to protect you for cold season. Good news is that even though I use acupuncture, it's going to be painless, so I just use the acupuncture points. I do not use any needles. And the other good news is I'm an expert in the field. I'm a graduate from the Bioenergetics Institute of Science in London. That was over 15 years ago. I've had clinical practice. And if you wanted to come in for other reasons to assess your whole organ and body system, we call it longevity testing. So I would actually test the longevity of all your organ and body systems. That would be anywhere from glandular, hormonal, immune, digestive, until we get all of them working optimally by getting the right biochemical match supplement and a diet and a lifestyle matched. So you'll have very efficient and quick changes in your overall results and your energy by actually putting them all back in balance and having the exact biochemical match for your constitution to make you healthy and to live as long as possible. Hi there, I'm Jacqueline. We're going to do the Vega testing today. I'll get you to hold this in your left hand, And I'll get your right hand up here. And we need a little bit of moisture for conductivity, so I'll get you to hold the cylinder like this. I'm just going to put a little water on the point. And so today the organ testing will be a reading of the body and organ systems between 1 and 100. 50 would be if they're doing really well. If they're 10 points over in the 60 zone, they're a bit inflamed or irritated. And if it's 10 points lower than a 50, it'll probably be the energy starting to go out. You're getting a little bit of a deficiency. So we want to catch them and bring them up in advance to prevent any kind of disease or imbalance. So the first one I'm going to do today will be the lymphatic system. So I actually test off the Chinese acupuncture points, which correspond to the meridian in your body that goes right to that organ or body system. And I work off your acupuncture point. And so we have under the lymphatic, there's a little bit of inflammation. So that could be associated with several things. We might want to see if you need just a little bit of a probiotic. So I would just put an item on the plate, see if we can actually bring down that a little bit of inflammation. And we brought it down to almost a perfect 54-30. So there's some kind of dysbiosis in your body. So this naturopathic probiotic actually had balanced it out. So taking this on a regular basis, and then us testing the different organ and body systems, which are also associated with maybe some dysbiosis, like the digestive area, then we can find out why there's a bit of inflammation because there's improper digestion or maybe a little bit of a yeast in your stomach. So the next one we're going to do is the small intestine to see if you need an enzyme also. So we do this for all 30 body and organ system points to balance them out. And so large intestine is the next one. So it's the Chinese acupuncture point that corresponds to your large intestine. So over time, after we have some inflammation and we're not treating it with a proper maybe food sensitivity or diet elimination or a probiotic or digestive enzyme, we start to lose a little energy. So what we want is the energy to come up. So for the small intestine, it could be a little bit of candida or a little bit of yeast in there, and we'll see if you took an actual probiotic, whether it would improve. So 47-60, so there's a couple imbalances in your the lymphatic, so that means the undigested food particles from the stomach are causing some inflammation in the body. Why that might happen is the digestive energy is a little low in the stomach, so the probiotic shows there is a little bit of dysbiosis. We can see if a digestive enzyme would also increase that. And then I just look at the baseline. So the baseline before we added any supplements was 35. Optimally, we'd like to get it to 50. So we'll see, along with the probiotic and a diet and lifestyle, that'll give you whether you need a digestive enzyme. And that one is a little bit too strong for your stomach. Came up to 65, so that wouldn't be the best biochemical match for you. The Chambers has hundreds of different brands, so we just use the best brand for you. And so this one is a 46 out of 50, so this particular product actually would help you digest all your foods, and it'll bring up the energy in your stomach, get more nutrients out of your food, and then if you have a little bit of candida, it would fight with that too. Great. So this is what we'll do for all 30 points of the organ and body system till we balance them out, and then you get a diet and a lifestyle to go with it. And then when you can get all your body and organ systems balanced, you'll have a lot more energy, and it's a great prevention for disease or imbalances in the system over time.
Very nice.
Thank you very much. I appreciate you coming in today, and we'll do the next 30 points shortly.
Thank you, Jacqueline. And I'd like to thank our staff, our supporters, have been through us throughout the years, and we're here for you to help you in your life journey.